News, everyday news on Prince Miller Entertainment TV. Remember guys to like, share, comment and follow and turn on the notification bell so that you won't miss any of our new uploads that we do upload here. Today is the 28th of August 2022, and so guys, as Limpopo author MEC PHOPHI RAMATHUBA faces criticism regarding her comments to a woman believed to be Zimbabwean, her counterparts in Zimbabwe are coming under renewed pressure about the state of the healthcare system in the country. In the video, RAMATHUBA tells a woman who she assumes is Zimbabwean because she speaks Shona that there is a huge strain on South Africa's health budget because he, President Emmerson Mnangagwa, doesn't give me money to operate you guys, and I'm operating you with my limited resources. You are killing my health system. Reacting to the video, Zimbabwean opposition politician Linda Sungirai Masarira wrote an open letter which was addressed to the Vice President and Minister of Health and Childcare, Constantino Chiwenga. Masarira wrote that the Zimbabwean government had failed its people. Government has failed to ensure people's rights to access to affordable, quality and basic health care in government hospitals. Most, if not all, public hospitals lack basic antibiotics, painkillers and chronic disease medication. Considering that the Ministry of Health gets at least 15% of the national budget, it is shocking how the Ministry of Health has continuously failed to provide quality health care to the people of Zimbabwe, she said. Chiwenga is in Togo to attend a World Health Organization Global Health Leaders meeting. Many Zimbabweans seek medical treatment in the country's neighbors, South Africa, Botswana and Zambia, while many go to the public health facilities. Other Zimbabweans seek treatment at private hospitals. In 2019, Section 27, Sasha Silson, writing on Becky Sisa, noted that legislation suggested that foreign nationals from South African Development Community countries should be treated like South Africans, paying for healthcare in public hospitals based on a means test which takes into account the individual's level of income. Fungai Tsuma is one of many Zimbabweans who live in Bedbridge near Musina in Limpopo and occasionally seeks treatment in South Africa. Tsuma says that South Africa's public hospitals are equal to, if not better than, private facilities in Zimbabwe. It's like going to a private hospital because the healthcare is miles ahead of what there is at home. But now it's going to be a bit tricky after a video of Zimbabwean in a South African health facility being shouted at has gone viral. For women who live in towns bordering Zambia and South Africa, it makes sense to cross to the borders to access better facilities and care. In Victoria Falls, Zimbabwe's prime tourist destination, expected mothers go to the Livingstone in Zambia for health care. Those who use Zimbabwean hospitals never know what they are going to encounter. If it's not power shortages, it's a shortage of medication as basic as pain relievers, a nurse told News 24. At some clinics, women are required to bring 3 liters of diesel for generator just in case there is a blackout during cesarean section operations. Zimbabweans who go to Botswana don't receive free treatment in hospitals. Those that end up using Botswana health facilities go to private institutions where they pay. Meanwhile, a woman who suffered a miscarriage at Salim Gabi Hospital in Harare successfully sued the government and is due to be paid 900,000 Zimbabwe dollar, about 20,000 rand. Valichi Baya initially sued for 1.5 million Zimbabwe dollar for pain and suffering after she lost her unborn baby because of neglect by nurses in 2020. A case has inspired many more women to share their experience at the hands of demoralized health workers in ill-equipped hospitals. Speaking at a press conference hosted by Women and Law in Southern Africa in Harare, and the woman suing the government said she gave birth on a hospital floor because there were no beds and their child was injured in the process. I gave birth on the floor and my baby had red patches in one eye and on the forehead after he fell to the floor while I was giving birth. The nurses only cut the umbilical cord and left him without proper dressing or cleaning. My mother-in-law cleaned and clothed him when she came for the morning visit. She said, according to the UN, there are 37.9 deaths per 1,000 live births in Zimbabwe. The rate in Zimbabwe is higher compared to its more economically progressive neighbors such as Botswana with 28.7 deaths per 1,000 live births and South Africa with 25.7 deaths per 1,000 live births. In Harare last year, 9 clinics that served as birth centers were shut down because of lack of trained midwives. Nurses earn an equivalent of 3,000 rand as such. Men are leaving the country for greener pastures. This year's government nurses have gone on strike twice, demanding better remuneration and working conditions. However, the government has failed to meet their demands. And so, guys, that's the latest here in the state of our healthcare system. And I still insist that Chiwenga is one of the worst health ministers we ever had in Zimbabwe. So what RAMATHUBA was saying on that video, she was correct, and she was 100% correct, but I still insist that that conversation was held at the wrong time with the wrong person. And it was, I mean, bed, she was due for surgery. So you can be talking about Mnangagwa, about I pay for this, I pay for that. I understand that she was frustrated, but at the end of the day, that conversation was done at the wrong place with the wrong person also. And so we hope that the Minister of Health, when he comes back from wherever he is, yes, he's gonna talk about this issue, because in PHOPHI, that's why Trukona one Wajinji are now crossing to South Africa. At the same time, a resistance manja yakuva South Africa kwacho ainakumira mushe, because I've read an article whereby many people are complaining kuti akomana wakusena uchongosvika ku hospital kandi clinic unochongona Zimbabweans everywhere, and ku Hebrew, ku Newtown, I mean all those places in SA. After that video leaked, those issues are now coming online now on social media. Saka mutemeko totukwenda ku South African public hospital as a Zimbabwean usina document and then got to my one, and so it's a very, very sad situation. At the same time, it needs to be discussed. And I was now married in a private hospital in South Africa, a public hospital. Kurukupisa, not all, but some of them kurukupisa, because you never know. Say. And so this is our daily news, breaking news, everyday news on Prince Miller Entertainment TV. Remember, guys, to like, share, comment, and follow. Bless up.